We launched a Center for Global Health because there are a lot of people here at Mass General that are interested in global health activities, involved in global health activities, and we really saw an opportunity to make the whole greater than the sum of the parts.
The mission of the Center for Global Health is to provide service, science, and education in a community-centered manner. We want to match our best scientists to solve the greatest scientific problems. We want our educations to teach and to train a new generation of global health leaders. We want our clinicians to care for people in need. We want this all to occur in a context that's culturally relevant, based in a community.
One of the beauties of this program is that it is not a separate track, but rather available to all of our internal medicine residents. And the degree of involvement really depends on each individual resident. And also we realize that there's a large diversity of residents. Some are more interested in clinical service and clinical practice in the international setting. Others have an interest in humanitarian and disaster relief. Others who might be pursuing subspecialty training might want to participate in some of the research endeavors or health policy endeavors. And so part of the mission of our global health program is to be able to accommodate and nurture all of those nascent interests.
Africa is full of problems, but you need skills to do the research. You need equipment to do the research. You need funds to do the research. And all these are provided in this link between us and MGH and Harvard.
This opportunity at MGH has so far helped my career in my career development, in that I've been able to interact with different scientists at the MGH who've helped me understand the problem that I'm tackling, that's a TB-HIV co-infection. And with these interactions, I've been able to transfer the skills here in that I can now discuss the problem and interact with the scientists here at KwaZulu-Natal to try and develop answers to innate immune responses in TB and HIV.
MGH has a long-standing history in disaster relief and going abroad to assist people during times of need. We were involved in Katrina, we were involved in the tsunami, in both those, and in the last Haiti effort we were with the Navy as a partner with Project Hope and the USNS Comfort. So we've been a group of people, a group of doctors and nurses, pharmacists, clinicians who have responded to international disaster.
One of the unique features of our international team that is very important is that we truly are a multidisciplinary team. We don't judge what we're going to see. We come fully equipped to take care of the full spectrum. If there's no surgery, then the surgeons help delivering babies. And we saw over 3,000 people and did over 300 operations in our field hospital in the first month. But everybody is multitask, and that's where having the sponsorship of a place like Mass General is so important, that we can reach out to these various specialties.
Thinking of the infrastructure where you have to think of less providers, non-physician providers or non-nurse providers even, that the technologies they'll use have to be, one, effective, have to be rugged, oftentimes have to deal in settings of no power. We've created this incubator that is made out of car parts and can be made and repaired anywhere. The air filter is from a car intake air filter so that it can be changed. The heating source are headlights so that you actually see when they're not functioning. There's a backup power reservoir that's a 12-volt power source that could be motorcycle or car batteries. And then one of our design requirements was that two small women had to be able to lift the incubator off of its base and be able to carry it up and down stairs.
I originally got involved in work in South Africa because we had a scientific question to try to answer, which was, why do children do worse than adults when they become HIV infected? I was fully unprepared for what I found when I got there. On the one hand, the extent of the epidemic was far worse than I had ever imagined. But on the other hand, I met people who were really anxious to get engaged in research and yet had no real opportunity to do that. So because of that, we decided that we would try, rather than bringing specimens back to the U.S., that we would try and set up a small laboratory in KwaZulu-Natal, which we did. That led to a bigger vision, and that vision was really trying to create what is here at Mass General at a site in the middle of the worst part of the AIDS epidemic, namely having research and clinical care right next to each other.
I think an institution like MGH that has a long tradition of research and has tremendous resources has the capability to make a positive influence on the scourge of the century, which is HIV/AIDS.
This hospital has a very proud 200-year history, and it's certainly my hope that as we enter the third century of its operation, that we will enter it with even more vigor and energy than we have had over the last 2 centuries, and that certainly applies in global health as well. There are certainly many needs around the world related to global health. We're engaged in a number of different areas, but I hope that this hospital and the very inspired and talented and dedicated people who work here will have an opportunity to make an even bigger difference in the health of the world in years to come.